Hello everyone, welcome to Dentospedia, one of the best and most trusted platform for dental board exam. Today, I am going to give you a short lecture from our endodontic module so that we can understand the chapter very clearly, that is the dental pulp. So let's begin with the introduction. Dental pulp is a connective tissue. It's a soft vital connective tissue which is located in the center of the tooth. It's located in the center of the tooth and it is enclosed within the rigid walls of the dentinal walls, and even though it looks very small, it performs some of the most important function that keeps the tooth alive and healthy. So definition of the pulp is the connective tissue consisting of nerves, blood vessels, ground substance, interstitial fluid, odontoblast, fibroblast and other cellular components. And why is this pulp unique? Because unlike any other tissue in the body, it is trapped inside this closed chamber, and so whenever any inflammation occurs, even the mild, this pulp cannot expand after a certain limit, and this is why the pulp pain is so intense. Coming to the function of the pulp performs four major functions, that is formative, nutritive, sensory and protective. The formative function is it forms the dentine throughout the life, while this nutritive function it supplies nutrition and moisture to the dentine. The sensory function is it helps us to feel the pain, pressure and temperature, while the protective is initiates the inflammation and reparative dentine formation in response to injury. And these are the functions why the pulp vitality is crucial for tooth longevity. Coming to zones of the pulp, if we look the pulp under the microscope, we see the four defined zone, that is the odontoblast zone, cell-free zone and cell-rich zone and central zone. Odontoblast zone is the outermost zone and it surrounds the periphery of the pulp. It contains the odontoblast cells which forms the dentine. The odontoblast cells forms the dentine and it is highly sensitive, and so it first responds to any injury. While the cell-free zone, it contains nerve plexus and capillaries, and it allows like a buffer zone allowing the movement of the odontoblast during the dentine formation. Cell-free zone lacks most of the cells, so hence it is known as cell-free zone. While the cell-rich zone, it contains most of the cells, hence it is known as cell-rich zone. And this cell-rich zone contains many of the fibroblasts and undifferentiated mesenchymal cells, and important for repair and regeneration. While this central zone, which is also known as pulp core, it contains the nerves, blood vessels and lymphatic, and it maintains the vitality of the pulp. So here in the diagram we can see the odontoblastic layer, the cell-free zone, which is also known as zone of Weil, cell-rich zone, and this is the central core of the pulp. And these layered organization is what allows the pulp to respond, repair and protect the tooth. While coming to clinical relevance, understanding the pulp is extremely important in dentistry because most dental pains originate in the pulp, and the pulp diagnosis resides whether we do restorative treatment or root canal therapy, or periapical diseases begins from the pulp pathology. A successful endodontic treatment depends on how well we understand this pulp anatomy and physiology. At Dentospedia, we break down every topic exactly like this: simple, clear, exam-oriented and clinically meaningful. To learn the full chapter in detail along with the diagrams, notes, MCQs and previous year questions and high yields table and live explanation, let's download the app Dentospedia today. Thank you.